Hi, my name is Jamie Pereira, and I'm here to talk to you about my case developmental paper I did on a 5-year-old male who will go by the name ER for confidentiality reasons. His mother, AR, was present to answer questions pertaining to the biopsychosocial model as well as the ages and stages questionnaire and to supervise my interactions with him. What are the implications to social work of understanding your child's development? The first 5 years of a child's time is where they're going to gain their most skills. It's the most rapid changing period in their life as far as development goes. By understanding a child and their biopsychosocial components, such as health history, family health history, mental history, social environments, economic status, it allows us to have a better understanding through that and their culture of what it is that plays a role in fostering their development. ER showed minor developmental delays in both communication and fine motor skills, but within range or above range for all of the others. Looking at what risk factors were present in his BPS model, I was able to identify that one of his primary caretakers, his father, is required to leave frequently for his job. He's in the service and will sometimes have to leave months at a time. This can be a big stressor or anxiety factor on a child. Another component is he's moved frequently himself. He was born in California. The past 2 years of his life was in Japan. And while in Japan, he had limited resources and access to programs that English was the primary language. So even finding peer groups and other kids his age to interact with and see on a daily basis was difficult. Recently he's moved back to California and he's started kindergarten this year. And when I did the ages and stages questionnaire and biopsychosocial, he hadn't quite started kindergarten yet. That's also another factor to keep in mind, that it's really, really the beginning of some of these developmental areas, and he hasn't had the time to really work on them and make sure that there isn't any concerns there, per se. In the ASQ, in the Ages and Stages questionnaire, a good tool to use is a good tool to use with populations of the Southwest. I say that because the ASQ is something that broadly lets you know if a child may need more experience in a certain area to build fine motor, gross motor, social communication skills. It's not something that's used to teach, and it's not really based off of cultural background. It's just specific to developmental areas and if they are capable or not capable of doing it. The ASQ actually consists of 21 questionnaires that is completed with their parent or caretaker, and the questions focus specifically on communication, gross motor skills, problem solving, personal social skill development, and that's all. The results of the test is going to show if a child's development in these particular areas, again, are within, below, or above average. What did you learn from this experience? It was an interesting experience for the fact that ER is actually a child that I've seen because I know his mother, and he isn't somebody that I would have thought would fall below the average range in the two particular areas that he did reflect being below. But there's things that you just don't notice. One thing that his mother, AR, mentioned to me was she's never bought pants for him that have a zipper, a button, or a snap or anything on it. They've always been pull up and pull down pants. Now, she is a married woman, but her husband isn't always home, so a lot of things she has to do on her own, and she has two young kids, considering he has a younger sister that's only 15 months younger. So things like that maybe the mom or caretaker isn't thinking of in looking at a child and where they are in their development early on can help us prevent developmental delays. And I think that is the key thing. We can identify the strengths that the child has and that actually his caretaker and family has, and we can use those to prevent deficits. And that was the biggest thing that I got out of this. Thanks.